Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, hi, good evening, everyone. My name is Dr. Vivek Patel. I'm a neurosurgeon, brain and spine surgeon, practicing in Western Mumbai, and I would like to share some insights regarding epilepsy, which is a very neglected but a very important topic.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So, see, in our brain, there are some electrical activities which are going on. Okay, just like it happens in our heart, the same thing will happen in our brain also. So it's
Yeah.
very synchronized. Everything is very much synchronized, right? But in certain aspects, certain conditions, the electrical activity increases. Like for say example, we have these water heaters, the desi jugadu water heaters people use in hostels. So suppose one guy uses plugs in his heater, and nothing is going to happen much. But say at the same time 10 boys are plugging in the water heater. So what is going to happen is there's going to be an increased load. So when there's an increased load, there will be a short circuit and the electricity will go off. So something
Yeah.
similar happens in the brain also. When there's an electrical overload, due to abnormal amount of electrical activity. It's also described as a storm in the brain phenomenon. So this
Yeah.
is basically a seizure where the patient will lose his consciousness. They will make very shaky movement disorders. They can be tongue bites. There can be flopping of mouths. There can be uprolling of the eyes. So these are the things which will be there. They can be even the patient may be confused after that. There can be a lot of headache after the seizure attack.
What is epilepsy?
So when a patient has repeated seizures, more than two is diagnosed as epilepsy. That exactly is what epilepsy would be.
What are the different types of seizures and do they affect people differently?
Yeah. So there are different types of seizures. Okay, they depend on where the unusual activity starts in the brain. All right. So as we know, our brain has it is made up of different areas, and if the seizure happens in that area, then the function of that area of the brain gets affected. All right. So it depends on where the unusual activity has started and how much of the brain is involved. So we usually classify seizures either as partial or generalized. Generalized involve the entire brain, while partial or focal would just involve a part of the brain, a very specific part.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not exactly. So we wouldn't, in more than 50 to 60% of the cases, we don't know what is the cause of the epilepsy. As in, we can't find a specific cause. But for the remaining ones, the common causes are first of all is head injury, then brain tumors, then any bleeding inside the brain, especially major bleeding, and also brain infections. In patients who are more than 65 years of age, 65 to 70, strokes and even Alzheimer's can lead to epilepsy. Genetics also plays a part in this. It's an ongoing research. All right.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
There are no specific, not a specific lot of symptoms that we can say, but the common ones which I would say is there is sudden jerky movements. Okay, there's tightness on this upper and the lower limbs. There can be tightening of the jaw. Okay, because of which there can be a lot of times tongue bite leading to bleeding. There will be frothing from his mouth. Okay, there will be uprolling of his eyes. Okay. Even at times the patient will have a very staring look. Will just keep staring in the open space. You know. So and he may say that I'm having a sort of a fear, or a very strange feeling. Okay. But this is what happens in generalized epilepsy, in which the patient may also become unconscious. They can be, the patient may pass urine, as in he may wet his clothes. These things can happen, and at times the patient will not even remember what has happened. Okay, so this happens in generalized. When I say focal or partial, it may just involve one side of the body, or it may just happen with maybe just twitching of his face or the face, or upper of the eyes. Just a single thing, or just say a flicker in his movements of the finger. So that also can be a type of a seizure.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes. So it's a very unfortunate thing that epilepsy is being misunderstood. Like since time memorial, okay, people didn't understand what epilepsy is, and has been attributed to a lot of especially in our superstitious backgrounds. They used to call these holy men, and they used to do some different treatment, which would definitely not help. Okay, so since it looks frightening, the patient also reacts with fear and have avoidance, and this leads to stigma.
How does this stigma affect people with epilepsy?
So, uh, so individuals with epilepsy often face negative attitudes and discrimination from others. All right, these negative attitudes are reflected in the reluctance to marry people who are epilepsy patients, and there are certain organizations that do not employ, people suffering from epilepsy, and there can be aversion to being in the same vicinity as them, and even there can be discouragement of their children from playing with the children who have epilepsy. And it is said that stigma can increase the frequency of seizures also, because it causes stress, which again is a common trigger. Hence we need communities to be need to be informed, and they have to be supported. I mean, there are a lot of places where you can't even especially in airline industry, patients having history of seizures are not allowed. I know this much for fact, and they also say that people with epilepsy should avoid driving and swimming for obvious purpose.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The most common or the most important thing that is to be taken care of is that the patient should never miss their doses. If the patient misses their dose, there can be a very high tendency for the patient to develop epilepsy. And when I say missing doses, it also includes taking a wrong dose or less dose or something of that sort. But apart from that, missing sleep, if there's very high stress, not eating food, or certain skipping the meals, if there is a lot of flashing of lights, if there's a fever, so fever, especially in children, leads to what is called as febrile seizure. Okay, and then as I said, missing of doses, and
Yeah.
even in female, unfortunately, during menses, due to certain hormone changes, can lead to
Mhm.
seizures. So you can, as in the patient can have a seizure diary where the patient can understand the triggers, and it will make easier for the caregivers also to understand what is to be done and what is to be avoided, so the patient doesn't have any seizure attack, or we can decrease the tendency for a seizure attack.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So, managing epilepsy, lifestyle modifications are something which really help in the long run. Okay, so we can have so the patient needs to adopt healthy habits, uh, including having proper sleep. Okay, because fatigue is a major trigger for many people. Then having the meals on time, having a balanced diet, having a nutritious diet, then physical activity in general also keeps people safe, and especially in people suffering from epilepsy. Okay, but I would take this with a pinch of salt, because I would say that this patients with epilepsy should try and avoid high adventure sports and extreme sports, okay, without consulting their physician.
Mm-hmm.
So, managing stress is one thing which will lead in a right way in avoiding epilepsy. Of course, you need to have a supportive group which can help you. Talking to a psychologist and all, or a counselor will also help.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
All right. So this is a tough one because in India, I don't know how practical it is, but at least in the Western world, what they say is that patients, the house of the patient where he is having epilepsy should be a big, wide, open space. The tables should not have sharp edges. They should be padded so that in case of a fall, there is no head
Yeah.
injury. So basically, why are we so scared for seizures, okay, or for the epilepsies like this? Uh, Usually, epilepsy does not lead to any fatal thing. But what happens is, if the patient becomes unconscious during the period of epilepsy, then say he falls. So say he is walking down the stairs, and if he has a fit or a seizure, then the
Mm-hmm.
secondary effect because of the fall can lead to grievous injuries rather than the epilepsy itself. All right. So these are certain things that are to be taken care of. Hence, uh, as they say, you have to make it's wise to clear away things that would cause falls, like cords or clutter, and to pad sharp corners of the table, as I said. Okay, even in the kitchen, it is wise to not use glassware or use the plastic ones or the steel ones, which are non-breakable. Basically, what I'm trying to say is that. Okay,
Yeah.
and even when the patient is cooking, has to be careful. There has to be some sort of protective thing around the patient. Okay? And one more thing is, it is prudent that I don't know how much it happens in that Indian household, but the floor should be covered with a soft mattress or something so that it can
Mm-hmm.
blunt the fall. All right. So these are the
Yeah.
precautions which can help in the longer run. And every room should have a toothbrush or some stick because when a patient has a seizure, the patient tries to clench his teeth. So it is better to whenever there's an episode of seizure, the first thing that the attendant has to do is place a spoon or a fork or say a toothbrush, between the jaws so that we can avoid tongue bites. This will help in the long run because we've seen a really bad, nasty gashes on the tongue and a lot of bleeding also.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
I said a lot, but still, just to remember, with the right treatment, many people with epilepsy can manage their conditions well and lead normal lives. All right, being aware of the triggers, practicing healthy habits, and having support makes a big difference. And
Mm-hmm.
remember, I mean, you are not a single one person. There are a lot of people around who have seizure episodes. So there's a whole lot of community which has seizures. So I would just say that just be brave, be strong, and be careful.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.